going to talk about proper restraint use and documentation here in the inpatient units. So currently we're using paper charting and documentation for our restraints. Today we're going to focus on charting of non-behavioral restraints. The process is very similar for behavioral restraints, just look at the differences in your packet. So we'll just go through the packet really quick. It gives you criteria of what you need for your restraints and what you need for your documentation. And if you're not sure how the process works, you can go to this algorithm and you can just go step by step. So when you have a patient that's hitting you, kicking, trying to pull out their lines or tubes, then you're going to want to initiate restraints. So when you initiate the restraints, you can go ahead and put them on the patient for safety, and then you need to call the physician and get an order from them. The only people that can actually sign an order are an attending or a nurse practitioner. They have to be independently practicing. So a resident cannot sign restraint orders for you. So then once you've talked to the physician and you said, this is the situation, this is what's going on with the patient, then you proceed with your paperwork. So as a nurse, you can fill out this whole documentation, what kind of restraints, what extremity, why you put the patient on restraints, and it's very important that you document the least restrictive measures attempted. So you want to make sure that you've done other things before you put restraints on the patients. For non-behavioral restraints, the orders are good for 24 hours. You check the patient and document every 2 hours. And then you also need to include when the patient can be removed from restraints. If you are applying restraints, say in the middle of the night, you can call a resident and get a verbal order for the restraint, but you need to have the attending or the nurse practitioner to sign your restraint documentation within 24 hours. In addition to that, you need to have that same provider document in the multidisciplinary restraint note why the patient's in restraints. So this part the nurse can fill out. You can educate the family here, and then the provider on the back of the page would sign this and put why the patient's in restraints and that they've assessed the patient. Your next step in restraint documentation is your flow sheet. You want to fill it out as indicated, put the current date, and you have to do a flow sheet every 2 hours. Don't just initial down, you need to actually put, you checked the hydration, what are you giving them? Are they NPO or are you feeding them? Do they have a Foley or are they incontinent? You need to specify here what's going on with the patient. When the patient no longer needs restraints, then you will write here at the top the time and date discontinued. Our restraint documentation is not correct and is not complete until you've documented all of those things. Part of our tool here in the inpatient units is a self-critique form of what's required for your restraint documentation. This should trigger your memory that there are 3 things you need to document in the computerized chart. First of which is being a care plan. So first is related, it's a nursing care plan related to mobility. You open the care plan, time and date, right here you need to type restraints. Expected outcomes, I usually will put no injury related to restraints. Just like that, initiate your problem and make sure you save it. The next thing you need to do in your restraint documentation is to educate your patient and their family members. So we do have a pamphlet here that you can give to your patient and or family members as to why we use restraints. This is probably most effective with family members, as usually if we're restraining patients, they aren't able to comprehend. Once you teach them with this, you need to do the multidisciplinary education note, which I have the wrong environment here. So the multidisciplinary patient education, you can go in here, scroll down to the bottom, click other teaching, and you can put restraints and who you taught. That's also a requirement of our in the computer restraint documentation. The last thing you have to do is in your 24-hour note is document that the patient is in restraints and you've assessed those. So in your 24-hour note, you go in here, put current time and date, subject, restraints, even if it's part of your reassessment, as long as you've mentioned the restraints, that meets the requirement. So now we're going to look at the proper placement of restraints on a patient.
Okay.
Now we'll talk about proper restraint placement. The actual type of restraint you have may vary based on who orders your supplies, but it's all the same concept. So you'll explain to your patient what you're doing, which we've already done, and we put the restraint on the patient, secure it here. When you're applying restraints, you want to make sure that you have 2 finger widths underneath the restraint. So you want to make sure that they have room, and part of your checks are to check their pulse. So in case of an emergency, when you tie your restraint, you need a quick release knot. So you want to make sure that you're tying somewhere on the bed that won't come off, and then you just do a quick release knot just like this. So you can pull it here, it's not going anywhere, but in case of emergency, you pull here and it's easily released for patient safety. And that's what I can tell you about restraints. Please let us know if you have any questions, and make sure that the priority is patient safety and your safety.